We take care of a lot of people who have been in automobile accidents, and I really make sure that we give them the best quality care. I make sure everybody gets quality care, but it's especially important for people that have been in an automobile accident to make sure that they heal properly. And there's a multitude of factors that happen in an automobile accident. The studies show that a rear-end collision at 4 miles an hour is the point where soft tissue trauma actually happens. So some people will recognize that, yeah, I'm in pain, I'm starting to get headaches, I'm starting to get numbness in the arm and things like that, and they're definitely motivated to make sure that they get care. But actually anybody that's been in an automobile accident is a candidate to make sure that they get proper rehabilitation, because not only do we have trauma to the muscle tissue, we have trauma to the spine, the joints of the spine, the disc tissue, and once that tissue is traumatized, if it's not taken care of properly and we don't give it the proper adjustments, make sure that things are balanced, make sure that the tissue is worked properly, scar tissue is going to develop. And at that point, that's where the deterioration of the spine begins. And as long as I've done this, I've seen people that have had accidents years prior. They come in, now their arm is numb, they've been developing headaches, their spine is screwed up, their discs are now deteriorating, they got bone spurs and things like that because they didn't get the proper care that they need to. But the uniqueness is that when the spine is injured in an automobile accident, what we're also dealing with, not only with the soft tissue injury, we've also got irritation and trauma to the nervous system. And that's the specialty of chiropractic, to make sure that we can get that nervous system freed up. Because as the nerves are traumatized, they're going to misbehave. Misbehavior of the nerves causes changes in the tissue and more muscle spasm, and then we create this perpetual cycle where the problem's actually beginning, not ending after the trauma. And it takes time. It takes time as the tissue is healing, because it's about an 83-day process for the soft tissue to actually remodel and go through the healing process the way it should and the way it could. And so our job is to make sure that the spine remains balanced. We keep the pressure off of the nervous system, get it off initially, and make sure that the body continues to heal. And then 5, 10, 15 years down the road, the work that we've done is going to dictate how that person's spine is going to be in the future.